Hello, this is Nathan Carlson coming to you again from the 24HourFlex studios. And we're going to talk today about HSAs. This is part 2. I'd encourage you to view part 1 if you haven't done so already. What is an HDHP? As I explained in part 1, for you to have an HSA, you have to be enrolled in a high deductible health plan. Well, there are two types of HDHP plans. One is self-only HDHP and the other is family. A self-only, of course, covers only you, the HDHP holder. Family is anything else, whether it's 2, 3, any number. The self-only HDHP has several requirements. First, there is a minimum annual deductible of $1,200 in 2010, excluding preventative care, and there's a maximum annual out-of-pocket that this policy must have, which is $5,950 in 2010. Of course, the out-of-pocket includes a deductible plus any co-pays plus insurance, and these numbers exclude preventative care. The family HDHP has higher limits. The annual deductible in 2010 is $2,400, excluding preventative care, and the maximum out-of-pocket expense is $11,900 in 2010. And once again, the out-of-pocket includes deductible, co-pays, and co-insurance. What is impermissible coverage? You cannot have health coverage other than an HDHP with just a few exceptions. Exceptions would be a health insurance coverage that covers just preventative care or certain permitted insurance and permitted coverage. Examples of impermissive coverage include, let's say your husband has an HDHP plan but is also covered by the wife's non-HDHP health insurance. So this person actually has double coverage, one by the HDHP and one by the non-HDHP. This would be impermissible coverage, and the husband could not have an HSA. Of course, the wife could not either. Or if either one, the husband or the wife, is covered by a general purpose health FSA or a general purpose HRA, then those individuals are ineligible for the entire period of coverage, even if the funds in the FSA or the HRA are exhausted. Let's take an example. A plan year goes from January 1st, 2010 to December 31st, and John is enrolled in a general purpose medical FSA. His election equals $1,000. Let's say that John exhausts his medical FSA on June 15th. John is still not eligible for the HSA until January 1st, 2011, even if John is enrolled in an HDHP in 2010. Why? Because he's enrolled in a general purpose medical FSA. Take another example where you have an FSA where there's an IRS grace period. The plan year runs from January 1st, 2010 to December 31st, 2010. And it has a grace period then going out to March 15th. John's FSA balance, if it's 0 on 12/31/2010, he's eligible for an HSA starting January 1st, 2011. However, if he has any balance at all in his FSA on December 31st, he is not eligible for the HSA until April 1st, 2011, which would be the first day of the month following the end of the IRS grace period. John can be enrolled in a limited purpose flexible spending account and still have an HSA. A limited purpose FSA is one that only reimburses dental and vision expenses. Note that it cannot reimburse over-the-counter drugs unless those drugs are directly used for dental or vision medical expenses. As an alternative to a limited purpose FSA or a limited purpose HRA, an employer can set up what's called a post-deductible FSA or HRA. The post-deductible is not discussed in this presentation. I just wanted you to be aware of that possibility. Permitted insurance, this is insurance that can coexist with an HSA, includes items such as workman's compensation, home and auto insurance, or insurance for a specific illness or disease such as cancer insurance, or insurance that pays a fixed dollar amount per day or for some other measurement period, like per week, of hospitalization. Permitted coverage with an HSA would include coverage for accidents and disability, dental care, vision care, long-term care. Examples would include auto personal injury protection or school sports accident policy, or an FSA that covers only dental and vision expenses, as I've explained, a limited purpose FSA. So in summary, HSAs provide valuable tax benefits. These funds continue to grow if they are unused, and they always belong to you, the HSA owner. They can be established by an eligible individual who has HDHP coverage, who has no impermissible coverage. And the funds can be withdrawn tax-free to pay for qualified medical expenses. Any funds that are withdrawn for non-qualified medical expenses are subject to taxes and sometimes penalties. Now, the tax status of HSA distributions are reported directly to the IRS by the taxpayer via your IRS Form 1040. You, the taxpayer, are responsible for retaining documentation and receipts that prove eligible medical expenses. That concludes the HSA presentation. Thank you.